बिस्मिल्लाहिर्रहमानिर्रहीम। आज हम एक डिस्कशन में थे जहाँ हमारे साथ कोलेस्ट्रॉल के हवाले से एक एक्सपर्ट प्रोफेसर पीटर लांसबर्ग, he is, I think, is authority in the field. So we are honored to have him with us, Professor Peter Lansburg, and he was talking about like drugs for cholesterol, especially statins. Something about a myth regarding side effects of these drugs. People are usually avoiding, leaving it by themselves, reducing dosages, something about that.
Yes. So I think statins have contributed very significantly in our capabilities of lowering risk for cardiovascular disease. And I've heard that in Pakistan that is an incredible big problem, especially even in very young people. Now, statins are able to reduce cholesterol and also reduce cardiovascular risk. One of the points that comes across, not only in Pakistan, but in many countries, is that people have the tendency to feel muscle symptoms, cramps, pain, sometimes joint pains, and they attribute that to statins. What we've known from a lot of large clinical trials is that that risk is not that high, that we only see a few patients that develop it. And just to give you an indication, in one of the trials, they scored the severity of the symptoms, and you could score from 0 to 100. And the average score was roughly 15. So, yes, some people might have some muscle problems, but these are not severe, and interestingly, they subside after 6 months, 9 months, sometimes after a year. And some people don't feel anything. I've been taking high-dose atorvastatin, 80 milligrams plus ezetimibe for more than 22 years. I've never had any muscle problems, except if I went to the gym and did too much, then I had muscle problems. So it is important that these side effects are not that common and are mild.
One common thing happening, people are starting various combinations, reducing dose of statin right from the beginning or outside. How do you see that in terms of getting more LDL reduction, especially ezetimibe? It's very common in our city. People are combining these two, reducing dose of statin and ezetimibe.
Yes. I think statins are most effective in the high dose. And in all the trials that we used to evaluate statins, all these patients started straight away with 80 milligrams of atorvastatin or with 40 milligrams of rosuvastatin. And the amount of side effects reported in these trials, when you compare the patients that used the medication versus the placebo, was actually the same. There was not a big difference. So sometimes patients feel things and they think, oh yes, I feel a little bit of muscle ache and I'm now taking this new drug. It must be the new drug. But there can be many other causes. It could be that you are getting a little bit older and your muscles are getting a little bit more prone to pain problems. It could be that you went to the gym 2 days earlier and you have some muscle pain from that. So realize also that in the studies where they looked at muscle problems, yes, the first 6 months there was a slight increase, but after that it completely tapered off. So your body gets used to it. And in that sense, it's not a serious symptom. It's a mild symptom that really blends out when you look at the incredible amount of risk you reduce by using statins.
Thank you very much.
Thank you. Very
for
nice.
The whole session and for this little interview for our viewers. Thank you very much.
Thank you so much. Thank you. Cut.
Thank you.